Hello, everybody, and welcome to another episode of Conversations in Aesthetics. I'm your host, Dr. Gary Goldenberg, dermatologist from New York City. And today I'm super excited to have a guest with us who doesn't need an introduction if you live in the acne or aesthetic world. That's Dr. Emmy Graber from Boston. Emmy, thank you so much for joining us and welcome to the podcast.
Thanks so much for having me, Gary. I appreciate it.
Well, we're going to start off with doing a quick intro. So why don't you tell the folks where you're from, where you practice, what your practice is like. I know you have a Philly connection like me, so let's hear about you.
Well, thanks. So I grew up in central Pennsylvania. I'm a Pennsylvania girl. Did most of my medical training at Penn State and did business school in Philadelphia at Wharton. Brought myself to Boston to do a laser fellowship because I always loved treating acne, but I had no idea how to treat the sequelae of acne and wanted to learn a little bit more about lasers. And thought I was going to be in Boston for a year. And here I am about 20 years later, still in Boston. And so I have worked in a number of settings, large private practice settings. I've worked in academia. I've worked in community healthcare centers. And for the last 10 years, I've had my own private practice. We're growing in size. We do all things general dermatology and cosmetics, but I have a special interest in acne and in lasers and aesthetics. So I purely do acne, rosacea, and cosmetics, and it's a good fit for me. I really enjoy this niche I've created for myself in the derm world.
That's great, and I think Boston is certainly one of the places where that are associated with lasers. So I
Mhm.
think you came to the right place, and you probably stayed in the right place. So that sounds really wonderful.
Yeah,
So
absolutely. I had a lot of great mentors here.
I think you have a unique practice. So I think some of our listeners may be interested in exactly how you went about building yourself a niche like this and how you sort of position yourself as this acne rosacea expert, not only within dermatology, but really, it's really business to consumer. And how did you go through that transition to be where you are today?
Yeah, those are great questions. I think I, my advice to residents and people graduating is, you can do all things dermatology, and that's great. But if there's something that you find that you really enjoy, and for me, I just kind of had this pool as a resident that every time I saw an acne patient, I was eager to go in the room. I liked treating them. I look forward to seeing them back. Because really, for our longevity and to avoid burnout, medicine is hard. We have to do what we like. That's just something that I always really enjoyed. I really enjoy treating acne and rosacea patients and seeing them become better. Um, y- for me, it's definitely been a journey working in a number of settings, and it took me a lot of soul searching to find out what works for me. And I went through a period of time when I was in academia where I was a little bit frustrated with the bureaucracy of academia, some of the politics, if you will, which exists everywhere. So I went to business school and kind of considered leaving patient care entirely. But really, at the end of the day, what I really liked was to see patients get better. And so I thought, well, how can I really best use my business degree and do what I like? And so I decided just to kind of follow what I enjoyed. um, I had some people along the way say, "Well, like you're really limiting yourself." And sure, to start off, I did all things general derm when I opened my practice. But I think it's really, if you're doing what you like, you can really take care of patients really well. And people see that. They see through if we're being fake, they see through it. And so you have to do something that you enjoy, and for me, this was it. Um, in this area, to kind of create myself as the acne expert, I did a lot of things, some of them consciously, some of them just happened along the way as I followed my interests. the more I dug into the acne community and got involved in research and giving lectures, the more my name got out there and people knew that I was kind of the person in the area to go to for acne. And I love the challenging cases. I love the patients that had seen 6 dermatologists before and have tried everything. And I enjoy that. And then, really, eh, medicine, what I've learned over the years is that medicine, it is a business. It's not, we're doing this because we want to help people, but we also need to do what um, we can to pull in the patients that we want to treat, and so that we can have these fulfilling careers. If I didn't do any marketing, didn't do any self promotion, I couldn't see just acne patients all day long. And so you do have to really work at it and do all of the marketing things too.
So you said a lot of different things that I think are pearls that I want to kind of pull out and tease out one by one. So this thing about doing what you like, I think, is really important. But sometimes doing what you like doesn't allow you to have a practice like you have in Boston, where rent is high, cost of labor is high, marketing is expensive, devices are. I mean, the device prices have. I mean, since I've been in private practice in 9 years, I think they've tripled in price. When it comes to sticker price. So doing what you like, I think, is important, but also being smart from a business perspective is important. So how do you find that happy medium between, getting the latest and greatest tech? I know we're going to talk about acne and procedures, which is something that I'm passionate about as well. But how do you finance or get the latest technology, be able to run a business, get payroll every 2 weeks or
Yeah.
whatnot, and still be happy and do what you like?
Yeah. Yeah, so you have to get creative.
I
That's
like
what
that.
I've learned. You have to get creative. In my office, I don't buy every brand new device. I was definitely an early adopter of one of the acne devices that we're going to talk about because I knew from the get-go that I had a population in this downtown affluent part of Boston that was going to really gravitate towards laser for acne, and I knew my population really well. But I don't buy every new trendy device on the market. You don't need 10
Agree
devices in
100%.
your office.
I agree
You really
100% with
don't.
you.
People overbuy lasers. They really do. You got to take really good care of them, have a person who can maintain them on your staff really well, and look after them daily, weekly, and they can last if you're taking good care of, but you don't need every device out there. I think people overbuy devices. Though I was quick to jump on the one of the 1726 nanometer lasers because I knew it would be good for fit for my office. And I tell patients when they're, or not patients, new residents or people opening a private practice, when they say, "What devices do I get?" I say, "Well, do you know your population? Because if you have a population of people with a lot of fair skin and a lot of sun damage, that's going to be very different than a younger population that maybe has a lot of darker skin tones." And so you have to really know who's coming into your office. You have to know what their price point is going to be, because that makes a difference too. In my office, to save money so that we can spend more money on some devices as we need them judiciously, um, we do a lot of our staff are gap year students, and that works really well in Boston because we have a huge population of young adults who are between medical school or between college and medical school or between college and PA school, and they want some clinical experience. We structure it. We try to get employees who will stay for a minimum amount of time. We offer letters of recommendation for those who do really well, and that's helpful. And we've employed a lot of technology that's been really a huge cost savings as far as reducing staff. Some AI technology, a lot of online scheduling, some virtual assistants, which have really helped our office. Traditionally, I started out, I opened the practice with all in-person employees, and that just doesn't work anymore if you want to be frugal and efficient.
So I want to talk about lasers first, and then I want to
Hmm.
talk about this AI and efficiency stuff because I like where this conversation is going. So I remember Steve Kreider, shout out to Steve, called me when he was at Cutera, and we can talk brand names here. It's fine. It's not CME. So we both have the AviClear device, and like you, I love it. I think it's a great addition to my practice. But I remember Steve calling me, and he said, "Look, I know you know about this device because I did some work with Cutera." I said, "I want you to have it." I said, "Well, who else has it? Who else been able to implement it and use it well in their practice where it's not just sitting collecting dust?" Because look, it's a paradigm shift of patients, saying, "Well, my insurance should cover my acne treatment," versus you got to pay out of pocket for a laser. And I've been doing laser for and blue light for acne way before AviClear even was a thought. Like you have probably. I've been using the 1064 and PDT for acne for a while. But Steve actually mentioned you. He said Emmy's been able to implement this device and use it in her office on a regular basis and have very good outcomes. So I think you were an early adopter in this technology, and I think your association with acne really paved a way for a lot of people to implement it. So I like how you think and position and frame it. But I want to talk about this AI and virtual employees real quick. So tell the folks that are listening to this, because I think being efficient with cuts in every single reimbursement, labor costs going up, rents going up, everything's increasing in cost. What have you implemented specifically that has worked in your practice, and how much cost savings, if you're comfortable saying, just you don't need to give numbers, percentages, do you think there is to your practice? Because I think this is a really important conversation. And it's not only for the mega groups, the groups that are 200 offices that are private equity backed, they've got the efficiency down, right? I'm a mom and pop business. Sounds like you are a mom and pop business as well. And for smaller practices, which are having a hard time surviving today, I think being more efficient is even more important.
Yeah. Yeah, I think, you can be a small practice, a mom and pop, if you will, and thrive. So we first implemented, we were having a crisis, I'll call it a front desk phone crisis, where we were having trouble getting employees who are really engaged for the long haul. They'd be great the first month, maybe the second month, maybe the third month, and then they'd kind of
Fizzle
not
out.
be yeah, not be as customer focused as I would have loved. And we needed reliability. We needed consistency. We have now 6 providers at my office, and they all have different schedules. They need to be detail oriented. And so in a pinch, I we hired a virtual front desk person who we hired through a company, who's located overseas.
And what is the
Um,
company that you're using?
the company we use is HelloRache, Rache, and um, there's all of their virtual assistants are based out of the Philippines, and
Hmm.
we um, use them to. We started off with one person to answer the phones, and it worked out beautifully. Um, so we kind of grew, and now we have a few people from the company answering our phones. The phones almost always get answered right away. People rarely have to leave a voicemail.
So do you give
They're
them a
very
script?
pleasant.
I mean, I'm sorry to interrupt you, but I want to know, like, I want a specific detail so the people who are listening, if
Mm.
they're thinking about this,
Yeah.
they
So we
they
don't do a script per se. I we the individuals from this company have previous experience in
Mhm.
healthcare, either as physical therapists, pharmacists, some of them are RNs. So we don't give them a script. They're educated individuals, and it's worked out well. We are very particular in who we hire. We screen a lot of people. Um, we screen candidates via video. They send us a video introducing themselves. We review their resume. Then we do a Zoom call interview with the ones we've filtered out. And we've gone through multiple rounds of candidates until we find the right one. I think that's another piece of advice when you really need someone. Sometimes it's so tempting just to hire someone who you're like, yeah, they're okay. Like, I guess they
Don't
could
do
do
that.
it. Or
Don't do it.
no, no, terrible idea. Like maybe I can train them, I can work with them. No, no, like we don't have time for that. So, I've changed my ways. I want the best person from the get-go. And so I have gotten a lot more selective about who I choose. And so these companies, and there's a number of them, we landed on Hello Raish, who was a recommendation from another dermatologist. Um, but the candidates, there's a wide variety of candidates, and we were really selective who we chose. And so then we progressed because that was working out so well. We were having an issue, although the gap year students that were serving as scribes for us were great. They leave every 1 to 2 years, and then there's this training fatigue with turnover. And training to scribe it takes even a really
It's a long
intelligent
time,
person,
for
takes a
sure.
long time. Like
And what
even
EMR are you on?
we are on modernizing medicine. And so um, we then implemented having a virtual scribe to do for each provider. So each provider is assigned to a virtual scribe. Again, same company, HelloRage being very particular who we got, pairing them with a provider. It took, depending on the scribe, anywhere from 1 to 4 weeks to get them really trained well.
So
And
they're
now
on the
all
phone. They're on the
So
phone listening
they
in.
are on an earpiece via a Zoom call on the iPad. So Modernizing Medicine is an iPad system. So they are via Zoom. You have to, of course, based off of your state, make sure everything is HIPAA
Yep.
compliant and do the correct disclosures to patients. They're on a Zoom call. We have the earbuds. I forget the brand that sits right at the tragus. So
Mm-hmm.
they can hear what the patient is saying, but the doctor can also hear what the scribe is saying. If they say, "Hey, doctor, I didn't catch that diagnosis," um, can do that. Um,
So
and
you're not using AI yet to do the
we
scribing
are.
for
So
you. Oh,
that's
you are.
that's the
Okay. So
next
let's
stage.
let's talk about that. Okay.
So our problem was the scribe is all the virtual scribe was always stuck with the doctor in their ear, if you will. So he or she's moving around to different
Mm-hmm.
rooms, but who's scribing the HPI, right? Because the clinical assistant's going out to the waiting room, grabbing the patient, putting them in a room. We ended up, there's a number of course, today there's a plethora of AI scribing tools, and some will integrate with modernizing medicine. And we looked at a couple of them, ended up going with modernizing medicine's AI scribe
Okay.
tool. But I am not yet comfortable with where it is for the impression and plan, like the assessment and plan of the
Mm-hmm.
patient and entering scripts. It's a little bit clunky, kind of how the provider has to speak to it. But we implemented that service for gathering the HPI. So our gap year student slash clinical medical assistant, if you will go out to the waiting room, grab the patient, put them in the room, hit the AI button on the within the electronic medical record. Say, hey, Jane, what brings you in today? Jane will start talking, and the medical assistant just looks like she's having a lovely conversation with the
Just
patient.
listening, and the
You're just
patients love it.
listening,
I'm
nodding.
sorry.
Have you
I'm sure.
tried anything for it? Is it itch?
Mm-hmm.
Who's bothering you? What's going on? And then AI makes this beautiful paragraph in HPI. And then the provider comes in with the virtual scribe in their ear and continues the visit, and the virtual scribe takes over.
So
So for
you are pretty techy.
we are pretty techy. Um, I think a lot of people have online scheduling systems in these days.
Sure.
We
I
have one of
use
those
Next Patient. I
too.
think it's great. Yep.
That's what I use too. It's great for us. Um, we have some providers at our office that take insurance, some that don't, some do cosmetics. We have 2 floors in my office. It gets some procedures can be done on one floor or the other. Like any software, it has its limitations, but I do think, it was the best one at the time that I chose it, and that was a game changer for us because it really keeps the schedules just full and cuts down on staff. So
No,
yes,
I
I have
agree.
notifications
I
too.
think, gives patients the opportunity to book any time that they want
Yeah,
by looking on the website.
yeah.
And I don't know if you've done this, but we've actually linked it to our Google profile. So
Mm.
if you go to Google and you click on make an appointment,
Oh, yes,
it
ours is on
goes
there
r-
too.
it goes right
Yeah,
to that next patient page on our website. So it's I
yep.
think it's worked out very well.
I agree. I agree, and it solved our Monday morning problem. Monday morning, patients calling over the weekend, canceling, and then everybody shows up Monday morning and the schedules are light, and I'm like, fill the schedules. And so it really solved that problem because people could fill it the last minute. So,
And it's in
um,
real time, which I love. I mean,
yeah,
it just, somebody could literally schedule, an appointment if they see an open slot 15 minutes before they show up. So
yeah,
I think it actually
yeah.
does help with the scheduling. So HelloRache is the software or the company you use for both virtual front desk
Yep,
and also
phone for
virtual scribe that you were
prescribed.
talking to while you're with the
Yeah,
patient, and then using the modernizing medicine AI. Any other
correct.
tech tools before we really take a deeper dive into acne?
Oh,
What else
tech.
are you hiding? What else should we know about your practice that people can implement? I like this
Oh,
conversation.
I don't know. I don't know that I'm hiding anything else. Tech stuff. I mean, I've looked at some of these AI tools for doing prior authorizations. I think that's going to be my next leap.
Hmm.
But
I don't think it's there yet.
yeah,
I've looked at a
that's
few.
yeah, that's my sense too. I'm not quite sure. I
It's
looked
gonna
at a
get
couple.
there. We're gonna get
It is
there.
gonna get there. Thank goodness, because this is like this prior authorization piece, man. It really takes up some staff time and energy, and leads to a lot of frustration, as we know. So, but yeah, no, that's how we do. Like a lot of people, all our patient intake forms on an iPad, so we're pretty much paperless.
So I use NextPatient for that. I don't know if you do, but they do that link where it
Um,
gets texted to the patient and then they fill it out on their phone. It's
Yeah,
it's
we
really
have a
pretty good.
different workaround. I'm trying to remember which we implemented first and why we did it that way, but we use the forms that Emma has a modernizing medicine. Emma has a separate service with forms that we
Hmm.
utilize. It's okay. It has some glitches at times, but
That's
pretty good.
modernizing medicine. That's how it is.
Yeah.
Everything. I feel like nothing is perfect, but I do feel like it's way better than where we were, which is flimsy paper charts and paper forms and just storing and
Yeah.
finding charts. I mean, that used to be
Oh my gosh. Yeah, that
just
was hard.
horrible.
The charts go
Lost. I mean, do you
missing.
remember lost charts? I mean, how
Oh yeah.
how terrible was that?
Oh, it was horrible. And you go in, it's like, it's the equivalent of a lost biopsy. It's like,
Listen,
well, I lost your
the worst,
chart.
and the worst is like when the chart is on your desk, and you're
Mhm.
like, "Where's the chart? I can't find the chart. No one can find," and it's sitting
Yeah,
on your desk, and you're
yeah,
like, "Oh my
or
God,
it's
it's
sitting on
me."
my desk because I didn't sign the note yet from a month ago, and that's why it's still
Exactly.
on my desk. Yeah.
With a super bill on the front. I know how
Yeah.
that goes.
Yeah,
Those
yeah,
those are
yeah.
not memories. Those are nightmares. So
Exactly.
listen, I want to spend a little bit of time specifically talking about acne. And what I
Mhm,
really want to focus on is something that I've been lecturing on for a while is that acne is a procedural dermatology condition.
mhm.
And I think you're on the forefront of that with all the devices that you use to treat acne. And I think that what's been really helpful, there's a lot of still heat on isotretinoin, and I think a lot of these lasers are a step that, in my practice, patients are more comfortable taking before they put their teenager or young adult woman on isotretinoin. So I know you brought a video of the device that we both have. So
Sure.
maybe young Luke can run the video while we talk about specifically why you think acne is a great condition for devices and maybe specifically about this one or other similar devices to it.
Yeah. Yeah, so, I have a lot of things I wanna say about this. I think it can be a procedural condition with the caveat that I still use a lot of isotretinoin. I use a ton of spironolactone, I use a ton, right? But there are people who can't take isotretinoin or won't take isotretinoin, and parents that won't do it. And some of these devices work beautifully. And I think, um, I forget what question you asked me, but I'm going to just talk and tell, you can re-ask me.
Irrelevant. Just go. You go ahead.
Irrelevant.
You do
So
you.
the issue with these devices, they work, but one, it's been general dermatologists treating the bulk of acne who aren't as comfortable with procedures. And in order to be comfortable with a procedure and out of pocket costs, you have to be comfortable talking about money with patients. And I think none of us got that training in medical school, and most of us didn't get that training in residency. And so it's tough for the average dermatologist, not as a criticism, but it's hard for them to talk about money for patients or they get nervous bringing up a procedure that might not be covered by insurance. And I think no one's going to do it unless we bring it up. And it really does work. Um, I can go over the stats for you, but I tell patients, and I think like many things in life, honesty is the best policy here. And that's what I say when I lecture about devices in acne. We're not promising 100% of patients that this is a magic wand and their acne is going to be clear. We're being realistic and telling them this helps most of my patients, which it does, but it doesn't help every single person. It is not covered by insurance. You know, it's if finances are a concern for you, maybe you shouldn't do this. And that's exactly how I say it to patients. Because I don't want the last thing I want is a patient I'm trying to help them get better. They don't get better and they've spent some money and they're angry with me when I'm really trying to help them. So I just tell them that up front. And a lot of people, I don't have patients. I have people who don't respond. Most do, but I have people who don't respond. But no one comes back and says, "Hey, I want my money back," because they say, "Yeah, you told me this might happen, and there is a possibility." So I think with any device, any procedure, if we're just honest with patients, it's your chances of success are so much greater. I think people complicate it in their minds and they get all nervous. And how do I talk to a patient about this? How do I want them to do it? But we just got to be honest. And the other point is these devices
Hold
are
on. I just want
helpful.
to I
Yeah.
want to unpack this real quick because I think this is very important because when you start talking about something that's not covered,
Hmm.
okay, it automatically implies that everything that is covered is going to work. And we know
Mm.
that that's just not true. We know
Yeah.
that patients, if you look at the global acne market, people spend billions of dollars annually
Hmm.
on OTC acne
Hmm.
treatments. Now, you and I, because we have a referral bias, because we don't see the ones that get better with OTC treatments, we're going to
Hmm.
say, well, those
Hmm.
treatments don't work. Clearly, they work.
Yeah.
But how many of your patients, when they come and see you, have tried this acne cream, this cleanser, this antibiotic, that antibiotic, and they're still sitting in front of you and they're breaking out, right?
Yeah.
So
Yeah.
nothing works 100% of the time. That's just
Right.
the truth. Even isotretinoin is only
Right.
effective in about 80% of patients if you look at long term,
Hmm.
because about 20% of patients are going to need another round of isotretinoin. That's
Yeah.
another 8, 9 months out of your life with monthly labs, monthly visits, et cetera, et cetera. So I think people just undersell. I agree with you, and I think that comfort level and having that conversation is
Hmm.
very important.
Hmm.
And things cost what they cost, but the response rate is a bell curve. That's what I tell my patients. There's some patients where the results are underwhelming,
Hmm.
and there's some where you're like, wow, I can't believe how well that worked.
Mhm.
It
Mhm.
really worked better than I expected.
Mhm.
So I like how you frame that. I think that's very good and it's clear and it's truthful and honest, and that's really the way to do it. So sorry to interrupt you. I just wanted to
Yeah.
unpack that because I think that's a very important point that you made.
Yeah, we just have to put it out there, and I have like more junior physicians at my office that any procedure they're going to talk to a patient about, they're like, well, what do I say to them? Like, just tell them the truth, you know? And sometimes we overthink it and we get nervous because we're not used to doing it and it's outside of our comfort zone. So I do think though I am surprised and continue to be surprised by how many patients want to do a procedure for their acne rather than take a medication. And we're not going to know that usually. We're not going to know that they want to do that unless we bring it up. There are some patients that come in and say, I'm not taking a pill, I want a laser. Okay, yeah, they've maybe done their research. But there are some patients and now when I start talking to patients, which, maybe they haven't done any treatment, which is rarely the case, like you mentioned, but I'll say, we have some topicals, we have some pills you can take, and there's, some lasers that you can do. And, I'll very briefly say, um, the oftentimes we can get the medications covered by insurance or partially covered, but the downside to the laser is it's not covered by insurance. And then I usually pause, and sometimes most of the time I'll get an indication from the patient of, yeah, no, I don't want to go the non-covered route. Or they'll say, oh, laser, yeah, I want to know about that. And then I can kind of steer my conversation one way or the other. But sometimes I'll get treatment naive patients who just want to go right to the laser. Okay. Sometimes I'll get patients that I know they're an isotretinoin candidate, and I try to talk to them about isotretinoin, but mom, dad, or the patient themselves, like you said earlier, they want to just do everything they can before they do isotretinoin. And unless it's causing them a financial hardship, I don't think that's a bad thing, because
Agreed.
the patient and their parents can feel like, okay, we've done everything we could, even if their fears about isotretinoin are unfounded. They feel like they've done everything they can before they move on. And they're also not going to blame you as the physician if they have a real or perceived side effect to isotretinoin. So I think it protects us too. I've had some of my biggest isotretinoin doubters want to do Avaclear, and I can think of two very recently that didn't work great for them. And then they went on to do isotretinoin, and they're like, well, okay. And it was an easy conversation. They're like, we're doing this, we've done everything else. And I didn't have to push them towards it. And it went much better for everyone, I think. So patients, I'm going in circles here a little bit, but patients aren't going to know about lasers unless we bring it up to them. And so we have to bring it up as an option. And hey, if they're not interested in that, no problem. We can talk to you about this and that and the other. And I'm not saying laser is even the first thing I recommend for patients. And I have some patients that want to do laser that I think, I'm not sure that's the best thing for you. I think you need X, Y, or Z, but that's what they want to do. I say, all right, let's try it, and then we'll go on. But I think practices that say, well, laser hasn't been successful for me, or I can't get patients to do it, I don't think they're bringing it up enough, quite frankly. Um, it should be part of what we
Part of your
consider to be an
consultation.
option.
Yeah, I
Exactly.
agree. And look, I think the other important point here is I think there are some things that are very basic that a lot of dermatologists don't review with patients. I
Mm-hmm.
think every acne patient or any dermatology patient needs a professional skincare regimen, which I
Mm-hmm.
think a lot of people just say, okay, just go to the pharmacy and buy whatever you want, which
Yeah.
I think is not appropriate. I think having patients on a specific regimen that's truly for their skin type is really
Mm-hmm.
important.
Mm-hmm.
And I think even with the lasers, it doesn't mean that they're not getting a prescription for an acne topical.
Mm-hmm.
In my mind, they still could use a topical prescription or two. They
Mm-hmm.
still need a cleanser. They still need a sunscreen. They still need a moisturizer. And I think a lot of times we're just so rushed that we just like run in and say, okay, here's a prescription for this, prescription for that. See you in 2 weeks or 4 weeks or 6 weeks, whatever it is. And it's just not effective for patients. I think patients now they want a treatment plan. They
They
want to
want
know
something
that you're
comprehensive.
invested. Yeah, they want to. I call it holistic. I talk
Yep.
about nutrition. I talk about
Mm-hmm.
vitamins. I put people in
Mm-hmm.
probiotics.
Mm-hmm.
All of these things I think have shown efficacy in their own right, and you put them together, it really makes for the best possible treatment approach. And I
Mm-hmm.
think if you're not using devices, you're kind of missing the boat there.
Yep. I totally agree. I
Okay,
totally agree.
great. Emmy, I'm going to put you, we have a few minutes left. I'm going to put you in what we call the hot seat, okay?
Oh boy. Okay.
So you can do this. I have faith in you. So I'm going to ask you a few questions about aesthetics, and I just want your first like gut kind of a response, okay?
Mhm.
And some of these we
Mhm.
haven't talked about because we talked more about business practice management, but
Mhm.
I
Mhm.
like it. But we're going to get into a little bit of cosmetics. So,
Okay.
favorite botulinum toxin and why?
Dysport. That's easy. Dysport, fast onset of action. I price it at my practice the same as Botox, and patients get a little bit longer out of it usually, and so they're really happy.
So, follow-up question for you because I'm a Botox. I mean, I'm a Botox first, Dysport second person, so I just want to see what you say. What do you think the equivalent units are? So 10 units of Botox
Mhm.
equals how many units of Dysport?
I think you're making me do some math here. So I think 10 units of Botox equals 25 units of Dysport.
And you still at that, because we used to say 30, now everyone thinks 25, right? So when we said
Mhm.
30, people said it lasts for longer. Maybe it's because of the actual
Mhm.
conversion. You
Mhm.
think even 25 units, you're getting more
Mhm.
longevity. All
Oh
right.
yeah, I've been doing that for yeah,
Okay. Fair.
19 years. Yep.
Okay. Favorite filler.
I love Restylane Define.
So you were a Galderma girl all along.
Mhm.
All right.
Mhm. Yeah.
Okay. Restylane Define. Okay. And is that the one? If you had to pick one and live with it forever, that's the
Yeah.
one.
Yeah, because I don't like doing lips and I can't use it in the lips
All
anyway.
right.
So
Fair. Okay. Favorite laser.
PDO.
Really? Okay.
Yeah. Well, no, okay. Oh God, it's a
Now, PDL is
tie.
your gut reaction. I respect
I
PDL.
mean,
So
it's my workhorse.
you
I
see
use
a
it
lot of
all the
red.
time. And well, I see a lot of red, but I use it in combination with lots of things for acne. So I use it for the macular erythema or post-inflammatory erythema, whatever you want to call it. I use it now for some patients who are starting isotretinoin because there's a study showing that they may be less likely to have a flare and respond faster, which I
Hmm.
absolutely think is true. And I use it a lot for rosacea.
So a follow-up question because I like where this is going. Is rosacea an inflammatory
Mm.
condition or a vascular condition?
I think it's both. I'm gonna,
You think it's both. You're pleading the
yeah,
fifth. All right, I'll let you
yeah,
have that one. Okay.
yeah.
Your favorite procedure.
I like doing toxins. It's
All
quick,
right.
it's easy, it works. If you mess up, it wears off. It doesn't keep
What's
me
not
up
to
at
like?
night. It's
That's what's not to
yeah,
like.
yeah,
And it's the gateway, right? It's the
yeah,
gateway. It's a gateway
yeah,
procedure to
yeah,
cosmetics.
yeah.
And what is the favorite condition of yours to treat? Is it acne or is
Oh,
it
yeah. Acne, yeah.
100%?
100%.
All right, I love it. Okay. Well, it's been a really great conversation. We've really enjoyed having you here on Conversations and Aesthetics. Maybe you can come back if there's something, some new developments in acne or practice management. I think I'm going to put you in the practice management bucket also now. I like that.
Oh boy. All right. I like it. I'm happy to come back anytime.
Thank you so much for being with us, and thank you everybody for tuning in to another episode of Conversations in Aesthetics. Remember, you can find all of our episodes on dermsquare.com. Thanks, everybody. Until next time.